how those patients are dependent or independent, it's up to you how much time you're going to allot in preparing them. And then next is remind those patients, ambulatory patients and those who have bathroom privileges that the food tray is approaching. So this will remind your patient or alert your patient to wash their hands or to finish what they're doing and to go to the bathroom to wash their hands and then clear their tables for tray. And then next is offer your patient bedpan or urinal. So of course you have to wear gloves first. And then offer your patient bedpan and urinal as necessary or whenever necessary or as needed. So for example, if patient wants to defecate or to urinate face before meal time, so you can offer them a bedpan or urinal. So bedpan for female patient and then urinal for male patient. So this is for female patient and then this is for male patient. And then after that, so we can start the bedpan and the urinal and then remove the gloves. And then wash your hands. Let's just wash your hands and then patients so they're able to help themselves. So assist them, put them in a right position. So you can reach the head of the bed. So reach the head of the bed. And then arrange pillows. Then let it clear over bed tables articles. And then let's place it in a desk position for food tray. Then next is see to him that all that patient has the chance to wash their hands. So do not allow or be sure that no patient is allowed to go through food tray with soiled clothes or linen, so that the patient will feel comfortable and can concentrate on their meals or on his or her meals. And then next is correct annoyance of any nature. So for example, when you know your patient, you know what annoys them. So for example, your patient wants to put his or her danger to the cup, except for meal time, they want to place it in within their reach. And then next is then next is that your patient has a drinking water and it flows. So again, if you are a military personnel, you are expected to wear an amazing sleep in carrying and taking the food tray because any delay in changing food trays will mean that the food becomes cold and unappetizing. So after the food is served, offer your patient whatever help or give your patient whatever help is needed. So for example, putting napkins, and then let's say cutting the meat or pouring drinks. So patients sometimes become tired due to lack of assistance. And then can leave the silver and dishes within the patient's reach and then leave the patient alone with healthy snacks because these patients like to help themselves in most ways, and like they overlook cutting the meat using their one hand or then so-called egg with using their one hand. And then like this, give the patient low. And then after the patient eats, so remove the food tray out of your patient's way when there is a delay in collecting them. Okay. And then leave your patient warm and comfortable and then wait for at least 30 minutes before lying your patient or returning them into their normal or lying position. And next is note how the patient is, especially if there is something unusual to you. So for example, the patient aspirate or vomit, you have to note it. Note also how the patient is routine diet, and especially if the patient special therapeutic diet too, because this diet again is particularly, especially we prepare for those patients, and this is a part of their treatment. And then note the amount and the liquid intake of the patient and also for those patients which is it is required. And then after clear all the materials and then wash your hands. So I think we can read good thing. Question. Meron yan na